Thank you. Good morning. Diana Gomez, Director of Public Health. And yes, thank you, Supervisor Chairman Reyes and supervisors. We have been, the priority when something like this happens, this is a novel virus. People obviously are concerned, they have questions. So our immediate priority was to get out information, accurate information quickly out to the public, which will continue to be our ongoing mission. I'm going to give you a brief background. I think everybody's pretty familiar with what it is, but just to review for everybody, coronavirus is a new strain that we started seeing spreading in China originally in the Wuhan region, and is now widespread in different parts of the world. We started seeing our first cases here in the United States were in Washington, and then in January 26th, we saw our first case here in Arizona. To give you some perspective, we currently, as of this morning, you notice I don't have a PowerPoint. It's because it's a rapidly evolving issue, and things change rapidly. But as of this morning, we had 5 confirmed cases in Arizona. Right now, worldwide, we have 164, or I mean, in the United States, we have it circulating, and state labs are testing to identify. So people are seeing the case numbers go up. And the reason we're seeing that is because we're increasing the testing. So it's important to emphasize that increased testing doesn't necessarily mean an increase in sick people. It just means an increase in identification of these cases, which is important because it helps us identify and mitigate the risk. So coronavirus is a virus that, again, is spread. It's spread through droplets via respiratory droplets that are produced when an infected person coughs or sneezes. We're recommending social distancing because what you want to know is that when it's droplets, it's anything within 6 feet. So we want to keep you, if obviously that's why we're telling people if you're sick, stay home.
6 feet?
Social distancing. That's an infected person. So that's what we're telling you. That's what we're telling people. When people are diagnosed, everybody needs to spread out.
Yeah, I need to spread these guys up before we continue with this. I don't have enough seat, but
okay, well, if somebody's coughing or sneezing, try to stay at least 6 feet. Hopefully people are heeding the warning. This is one of those instances where it's really going to come down to personal responsibility and being informed. If you're sick, we want you to stay home. And that's going to make a huge difference. And I'll go into that. But normally when somebody is diagnosed, the symptoms are fever, cough, difficulty breathing. And these can come on anywhere between 2 to 14 days after exposure. It's important to note that just because you've been exposed, or even if you are infected, you may not show symptoms. And it's possible to spread the disease without any symptoms. So, and not everybody that is infected gets very sick or may not even show symptoms. So again, that's why it's important if you are sick to stay home. So who's at risk? And basically it's the general population, but the people that have a chronic condition, it's the usual people that we see during flu season. If you have an immunocompromised system, if you have a chronic health condition, the elderly are more at risk than the general population. However, this virus has the possibility to infect anybody. To protect yourselves, we tell people to wash your hands, first of all, and avoid touching your face, which is something that is very hard to do.
Yeah, for me.
And so we tell people to wash your hands for about 20 seconds, which is what it takes to sing the happy birthday song twice. Shout out, I was at an event, a public event this weekend, and there was a mom with a toddler, and I just heard her say, remember, we have to sing happy birthday twice. And I wanted to high five her, but we're doing social distancing, and it probably introducing yourself as the health director in a public restroom is probably not the best way to approach somebody, but it means people are listening, and it's good. That's what we want. If you can't, go ahead.
no, the question, I mean, I know we're in flu season already. So, having somebody cough or something may not be necessarily a sign. How can you tell? Is there a difference?
So the symptoms are very similar. What we're doing to distinguish whether you are at risk or for increased testing is if you've been exposed to somebody that has either tested positive for the disease or has come back, they have traveled to one of the areas where there's widespread And so you're looking at like China, you're looking at Italy, you're looking at some of those places in the United States. You're looking at, for example, where there's community spread, like Washington, Seattle, those areas. But yes, flu-like symptoms would be very, very similar. And because it's flu season, it's not too late to get your flu shot. It's not going to protect you against this, but it will help, provide some protection against the flu. And again, if you catch the flu, you're going to become, you're going to develop some sort of, your system's going to be compromised, which puts you at risk for other things among that. So, right now what we're doing is we're working just to give you an idea of plans. We practice for this all the time. It is flu season, but we practice for outbreaks, we practice for pandemics. We have a program that's specifically devoted to that, just to give you an idea of proactive steps. I'm very encouraged by the fact that a lot of organizations and people putting on events have reached out to us proactively and said, for the record, we haven't had a confirmed case in Yuma County. And at this time, we don't have any evidence, just like we don't have a confirmed case of community spread. But these event organizers and these institutions, are concerned, and they want to reassure the public. And so what they've been doing is they've been reaching out proactively for guidance. What can we do to make sure that people feel confident coming to these events, or that people feel like we're doing what we need to do to make sure, we help protect their health and wellness. And so that's very encouraging. We've seen that from schools. We've seen that from event organizers. We have elections coming up, and the recorder and elections office, we met with them, last week. And again, over an abundance of precaution. Everybody's taking steps to just, sanitize a little more regularly, to just make sure they have signs informing the public of what they can do. So very similar to what we would do during regular flu season. But people are just taking that extra precaution, maybe wiping down surfaces more often. So we've done some preventing educational awareness. Like I said, we've had one-on-one meetings with different organizations. And, for example, the school back in January, a shout out to, Arizona Western College. They were planning just in case we were seeing measles outbreaks last year. And so they wanted to prepare for that. So they put on this event. We worked really closely with them, and Dr. Elliott Nelson invited different representatives from the different school districts in Yuma County, but she also invited representatives from across the border. And so we had a very good tabletop exercise discussion. There were questions, that were raised, and going through those exercises allows us to come up with things that maybe we hadn't considered before. It makes us better. And so there was very good dialogue. And the very, very next day was the day that it was announced that we had our first case in Arizona, which happened to be a university student. So that's the value of being prepared. People ask, are people overreacting, or people, not taking it seriously? And the truth of the matter is, it's important to recognize that it's new and people are scared and they want to know how to protect their families. And so the key here, and what I can't emphasize enough, is that it's important to have information, be informed. That's the best thing you can do. Our media partners, we reach out to them because they're key in promoting our message. And it's important for people to know that if it's not coming from a trusted source, if you're not hearing it from the CDC, you're not hearing it from the state health department, you're not hearing it from us, you probably should be cautious. We fielded calls and inquiries from people that read stuff in social media that was unfortunately not accurate. So again, having accurate information is the best way you can do, the best thing you can do to protect yourself and your family. So again, let me go back and give you some perspective. So right now, we have 164 confirmed presumptive cases of the virus in the United States. 11 of those have resulted in deaths. 19 states have reported cases. To put that into perspective, to go back to your flu and not to minimize the situation, we've had 32 million flu confirmed cases in the United States, and unfortunately around 18,000 of those have resulted in death. So we're taking precautions that we would normally take, just a little bit more heightened, because again, it's new. So what we're telling people again is wash your hands for 20 seconds, sing the happy birthday song like the mom did with her child. Very, very important. If you cannot get to a bathroom or you don't have one readily available, you can use hand sanitizer. It has to be alcohol based, and it has to be above 70% or 60% alcohol content. And again, if you're going to do that, you need to cover your entire surface. A lot of people, that's why we promote washing your hands, because people are more vigorous washing their hands. A lot of times people put hand sanitizer and they're like, that's it. So please use it appropriately. Avoid close contact with people that are sick. If you are sick, please stay home. Cover your cough or sneeze with a tissue and immediately throw it away. And disinfect frequent touch surfaces as needed, so frequently. So what we're looking at is, again, if you're touching, regular surfaces, we don't know necessarily that you need to do it more often than not, but again, a good wipe down with a good disinfectant should do it, or a diluted bleach solution. And if you've traveled to one of the areas where there's wide community spread, and within 14 days of returning, you come down with the symptoms that I described before, which was the cough, the shortness of breath, the fever, then call your healthcare provider, and they will give you some guidance. If you think you've been exposed, or we're telling people, please call your healthcare provider first. Don't just show up. They're going to give you guidance. We are working very, very closely with our clinical partners. We field calls from the hospital, from urgent care, from regular physicians. We have daily calls with the different partners, healthcare partners. We're getting CDC updates on a regular basis, probably 3 times a week at least. We're working binationally. We are a border state, so that's come up. We are having frequent dialogue with our partners across the border. We have excellent communication with the state health department. They are doing an incredible job of making sure they coordinate calls, that we have the same information, that we're having an opportunity to ask questions, because the goal is to make sure we're able to respond in our community. But as different counties, it's our job to make sure we maintain the infrastructure across the state. So Dr. Christ and her team at ADHS were here during H1N1, and my team and I were here during H1N1 as well. So we've gone through this before. And so again, it's important to have information and be prepared. And so again, taking those simple precautions goes a long way. Is there any specific questions you want to?
Sure.
Diana, are the test kits available here in Yuma County, and then how long are they taking to get the results back?
So what we're doing right now is the testing is happening at the state health department. They have the ability to process up to 450 specimens a day. What the state is working on is they're working with commercial labs, so tests will become more readily available. Right now, the turnaround time is within 24 hours. So what would happen if you were ill, let's say, it was a suspect case, we would work with the healthcare provider. We would go through a series of screening questions to determine the criteria. If that was the case, it would be forwarded to the state lab. They would process it, and we would know within 24 hours.
Let me give you a more specific question.
Okay.
We were in Washington last week
Uh-huh.
at Representative Gozar's office.
Oh.
Obviously, we shook his hand. He was very friendly, too.
I didn't.
Oh, that's right. He didn't. I did. I knew there was something going on. But anyway, I mean, those are the type of interactions that kind of brings the question up. I mean, how long can you be, if you're concerned, if you're saying, okay, well, the gentleman already, he's quarantined himself.
Mm-hmm.
So how do you handle that?
So we're looking at the symptom onset would be anywhere between 2 to 14 days, and we're looking at that exposure. It would be very similar than the infection rate would be very similar than regular flu. I was in DC the week before that too, shaking hands with people. And so again, that's why we ask you to, wash your hands. And so if people think they've been exposed, then we say, maybe isolate. But right now the risk would be very similar to what you would do during regular flu season. And normally we don't, you come in contact with somebody who has the flu, and we don't isolate right away, or we don't, you know.
Is there something we can do as a county to, sort of a preventive measure? I've seen a lot of those dispensers with
Yeah.
antibacterial in different places. Is there some way that we can start, offering that kind of
With the hand
service?
sanitizers. So again, for the public areas and places where there's high traffic, we're telling people just wipe down surfaces maybe a little more often than you normally would. It's good to have hand sanitizer. We prefer people wash their hands. The hand sanitizer is convenient when you can't go to, when you can't be at a bathroom and wash your hands. So it's not a bad idea to have that. And again, just having that awareness that
Well,
the touching your face is huge.
yeah. Yeah. Well, but I mean, look, I understand that people are being asked to wash, but people are rushing through.
Right.
I'm saying, look, is there a way that we can start providing that at county facilities? I mean, as a public service.
So I've talked to a lot of the agency heads, and like I said, we met with elections, and most of them already have that. They've been doing that. Most of the organizations are very proactive about doing that, and they have been. So we've gotten lots of calls, and again, over an abundance of caution, people normally do that during flu season, but I've seen those, to your point, I've seen those sanitizers out more prominently in a lot of, and I've seen them in county buildings. So, and we just want to encourage, people to have that available. So,
Well, I would
but we
do
do.
that. I would send a memo out saying if they're available, because with the panic,
Right.
it's just difficult to find anything anymore. Any sanitizer or antibacterial hand wash. If you go to the stores, that's what you see. You see empty
Right.
shelves now because people have gone out, panic buying everything. It's just.
Right. And we're updating again for communication. We're updating our website. People can go on there. People can call us. Our communication, the county's communication office has done a really good job of updating people via social media, Facebook. We have dispersed some hand sanitizers. We've had inquiries from places where it was important that they have them, and they didn't. But for the most part, a lot of people, as part of their preparedness plans, particularly here in the county, have done that. I've met with other elected officials, and they have done the same thing as well with other municipalities. They're just being proactive. They put out the hand sanitizer. First responders, we want to make sure that they're taken care of. I've had a couple of meetings with fire and paramedics and EMS, and so they're taking those precautions. They're aware, and so again, that work has started quite a while ago, and that's the best thing you can do. The best thing you can do is always plan ahead and be prepared. And so again, over an abundance of caution, because we don't know, the situation evolves, and so it may not be a matter of will we get a case. It may be when we get a case, and when that happens, we're gonna again highlight the same precautions, and we're gonna follow the same protocol, and we're gonna increase testing. So it's gonna be an issue of, again, be informed, be prepared. You wash your hands, use the hand sanitizer, and keep informed. And
One
it's
more.
okay to ask questions.
Yeah, one question.
Yes.
Because this is a new virus, are you, is it an assumption that people should make that it will go down as the temperature heats up, or do we know yet whether that's going to be the case? Is it like most flus, or is it?
So this is a novel coronavirus, but there are other coronaviruses. We saw SARS and we saw MERS, and we saw those go in cyclical patterns just like the flu. So it's been said that there's a chance that when it, like to your point, that when it warms up, that's typically when regular flu kind of tapers down as well. Flu season can start in September, October, typically peaks in January, February, when we saw the increase in these cases, and usually tapers down around April, but it could go all the way through May. So we're hoping that that's the case. More likely than not, though, it's these increased mitigation strategies that we're doing. People being hyper aware of the social isolation, of the precautions they need to take. So a combination of those two things hopefully will, taper down the number of cases again, or of infections, not necessarily the cases because we're testing. it's also important to note that there's currently not a vaccine. They're working on that, and so right now, again, not everybody that contracts the disease becomes ill, and not everybody that contracts the disease that becomes ill has serious symptoms, but it could be very serious to people that have underlying conditions. So just, it's very similar to flu, but yeah, we're hoping a combination of the increased public awareness, the mitigation strategies, and hopefully the natural trend of flu and coronaviruses included help bring that down.
Well, is there a number of people can call for information?
So they can call the health department. So it's 928-317-4550. They can visit the yumacountyaz.gov website. There is a banner. You click on it. It takes you to the health department page. Actually, any site that you visit on that banner will lead you to that. And it'll give you information to the CDC, to the Arizona Department of Health Services. We're updating the information daily as it becomes available. Again, welcome to call the office or visit the website.
May I ask a question?
Sure.
I hired a local agency because my husband had a stroke, and they come to our home to give him a bath and dress him, and they sent 2 people that
No,
are
I
sick.
can't. I mean, if you are going to ask a question, we can hear you, but on TV, you won't be seen. Is it okay? Is that okay?
I'm asking her.
Yeah.
So I really don't care if it's on TV or not. But they sent 2
No,
people.
we do though. I mean, I'm telling you right now, if you're gonna ask a question, normally we ask people to come to the podium. And I'm just telling you that we're gonna do this to let the audience know that that it's coming from
You want me
someone
to
in the
come
public.
here?
Yes.
Yes.
Fine. We hired a local agency because my husband had a stroke, and they've sent 2 people now that are sick. They're coughing and sneezing and so forth. So I went to their office and told them this, and they said that their workers are supposed to report to them if they're sick or not. Well, how am I supposed to know that by the time they're in my house sneezing and coughing? You know what I'm saying? So you need to get on these local agencies about sending out sick people to people's homes who are sick, because they visit my house, then they go to another house and another house and another house.
Mm-hmm.
So y'all need to get on that.
So to the point, that's why we're telling people to stay home if they're sick. One of the things that we've done is we've actually, the Arizona State Health Department set out a series of webinars, again, highlighting the importance of that for healthcare facilities, for healthcare workers. We're telling all employers that if your employees are sick, they should stay home. We have no way of knowing if that's happening or not.
It's not.
But that has been the guidance. That's been the guidance that we've emphasized. We've told some employers you might need to, especially if there's, depending on your policies, it's important at this time that if the employee did not take the initiative to stay home when they're sick, and you as the employer realize that that's the case, that you need to let them go home. So I will step out right after my presentation, and if you want to follow up.
Thank you.
Okay.
Thank you. Thank you.
Thank you.
Any additional questions? I mean, sorry, from the board?
Well, yeah, one more
Okay.
I've been wanting to ask. So when you were telling us the numbers of total flu cases and deaths of both types,
Right.
I was trying to do the mental math real quick. It almost seems like the regular flu is just as dangerous. I mean,
Yes.
percentage-wise.
We see, the flu, unfortunately, the rate of flu, people die of the flu every year. Like I said, the number was really high. We've
Yeah.
had about 18,000.
Yeah.
And so again, it's one of those things where the precautions are the same because it's a respiratory virus. And so we tell people this all the time, with the flu. And so again, we have a novel virus. It's different. It's new. People are uncertain. And so it's of concern. But yes, regular flu season. And again, it evolves. But normally the precautions that we're talking about should be the precautions that should be taken during flu season. So yes, to your point, that's correct.
That's about the same.
But is the mortality rate the same?
The mortality
That's what I
rate
was
for this
talking about.
particular virus so far has not been the same as the flu.
It's higher,
The flu
much higher.
mortality rate has, and infection rate is significantly higher.
So that's what the problem is.
The flu,
The
Yes.
flu is higher.
compared to coronavirus, yes. So the mortality rate and the infection rate of regular flu, what we see every year, is higher.
Well,
That's what I
obviously,
thought when you gave those numbers.
I don't think I follow that, because when I was talking about a mortality rate, I was talking about the percentage of people who can die from this sickness, and you're talking about the number of people dying.
Oh, okay. So
That's
so
a
the
different thing.
the mortality rate for coronavirus is significantly lower. I think we're looking at 2% maybe right now. And again, it evolves as the changes as we get more information. But yes, the mortality rate from regular flu is much higher than the mortality rate that we know of for coronavirus so far.
All right,
That's what I thought I got from
All
your
right.
numbers.
So far.
right. Well, thank you.
Thank you.